All right, so we're going to get two answers for those two questions on NHIF from Gilbert, who is here representing NHIF, in just a bit, but we need to also get closing comments. But for everyone specifically, I would want a different topic. So Dr. let me begin with you. I am here searching just medical marijuana on the internet. Hear this: 3-year-old is focused on medical marijuana battle. Medical marijuana helps stem a 6-year-old seizure. Marijuana stops children from severe seizures. These are different topics on children and what it's been able to do. Marijuana slashes seizures in kids with rare epilepsy, according to a study. And all this is just from typing that as well. Can we one day consider cannabis as medical marijuana? Will we see a cooperation of herbal doctors and doctors as well?
Well, I think those are two different concepts. The medical marijuana debate, I think, is a healthy debate because it has been applied in other settings, particularly in the developed world. But I think the most important consideration is for it to be very well regulated, because there's the role of marijuana, particularly in pain management, which is a big issue, in cancer management. So I think that's a conversation that is happening, and I know even within the ministry, there's a unit that's dealing with traditional and alternative, medicines, and I believe that's part of the discussion that they may want to have on what role, in particular, medical marijuana can play in this country and how it's going to be regulated.
Yes, but the role of complementary therapy.
Yes, but the issue of herbal, doctors and mainstream doctors working together, I think that has never. From where I sit, I don't think it's a problem. In fact, the ministry through KEMRI has actually even created a mechanism through which the herbal doctors can have some of their products tested. Because as medical doctors, we are obligated to do no harm to our patients. So you must be very convinced about the evidence around a particular product. And that's why the ethnobotany unit at KEMRI was established for us to be able to test. So I think that's something that can happen. As long as the herbalists are willing to put to test some of the products that they're coming up with, I don't see any problem. And in any case, most of the conventional medicines we see stem from some herbal origin, from some herbal trees or so. So I think there can be convergence.
Right.
Only if people are willing to collaborate. Yes.
Okay, David, you are the outgoing chairman for the Kenya Network of Cancer Organization, as well as the vice chair for the Non-Communicable Disease Alliance in Kenya. You get to interact with Kenyans on a daily basis from that front. Are Kenyans very sensitive about their food, their health, what they put on their table? Because I think that's where even perhaps this conversation for cost of healthcare, cost of cancer should have started.
Absolutely.
What it is that you're eating, what you're putting into your body. Yeah,
but it's not just the eating. I think we need to look at the whole aspect of health promotion and prevention of disease, and mainly non-communicable diseases, which where lifestyle is a big driver. We know for sure that processed foods, all processed foods are a major risk factor for colorectal cancer and other diseases, as well as the type of food we are eating, very heavily fried, dripping with oil every day. We know red meat, for example, is also a risk factor for colorectal cancer. So we need to have a paradigm shift to a people who seek health care for promotion and prevention other than wait for illness to happen. And how do we do this? The government needs to invest purposely on health promotion. Let's get Kenyans walking and exercising by making sure our towns have, good lanes where people can cycle or walk or run. But we need to promote that as a prevention. We also need to look at the whole issue of advertising of unhealthy foods to our children. If you go to a supermarket today, all the sweet little things are just by the teller where kids can reach them. Your chocolates and sweets and all those things. They are part of the things that are driving our obesity rate. So we need to regulate the whole issue of sugar sweetened beverages, how they are advertised and presented to our children. But also importantly, we need to have this as a deliberate part of the curriculum in schools. Get schools, kids running and walking around, get ourselves avoid the border if you can and walk.
Okay.
So there are things we can do, but we need to have a proper mechanism to promote that. But maybe just this one thing, HPV is a virus that causes cervical cancer. The vaccine is in town, it's coming sooner or later. So we need also to get our girls vaccinated. You know, it's one of the preventable cancers, and we need to, once it is launched, we need to get our girls really going for this. It's part of prevention.
Right, so prevention any day. All right, Sally, I'll let you have your closing remarks, and perhaps for me, I would love to hear on the issue of quality data, cancer data. Did you find it that when you were doing research, was there enough information? Is there enough information outside there?
I must say that there should be, but it's not shared. Maybe because of confidentiality issues, but yes, there is data. For example, when I got colon cancer, I wanted to know, is there anyone else living with this condition of wearing a stomach bag? And the nurse was taking me through, and that included Mr. Makumi. They showed me that yes, there are other people, and that's when we started a group. We started when we were only 6, and now the group has grown to over 1,000 countrywide. In Nairobi alone, we are over 300. And I must say that support groups really help, and that is what has made me to be a cancer advocate. Right, and more data, more information. More information is required.
All right, Gilbert, for you as our representative of NHIF rather in this conversation, I'd love to let you answer to those two comments. If we could have one up right now very quickly, we get Gilbert's answers. This is the one from Kizito asking the issue of this NHIF cover is a fog. I am in Mombasa, Aga Khan, and he needed a biopsy, and at any moment the receptionist kept insisting that NHIF only covers only civil servants. How come? And I do pay 100,000 a month. Could you answer to that one?
Thank you. First and foremost, we do cover for biopsy, including in Aga Khan in Mombasa. What is there is that for any procedure, we normally request that the facility launches a pre-authorization request prior approval from NHIF. I believe the client should be informed that indeed we do cover. On the issue of paying 100,000, because our rates are graduated unless the member is a member of managed schemes, corporate schemes. Otherwise, I wish to assure him that he can go to our offices or any Huduma center, and his case will be attended to comprehensively. But I needed to respond to the issue that Makomi addressed pertaining to what NHIF covers under the oncology package, that is the sessionary payments that we do for first line and second line. We want to incorporate in future, we want to move away from the sessionary treatment to the continuum of care. That is, we are waiting for the National Cancer Institute and the regulator, the Ministry of Health, to issue the latest guidelines on cancer treatment and protocol.
Right.
We will make a shift from the sessionary treatment to the continuum of care.
All right, because of time, I'm afraid that that's where we have to stop the conversation. But thank you very much. That is none other than Gilbert Osoro, Claims Manager at NHIF. Of course, we also had Dr. Alfred Karagu, who is the CEO of the National Cancer Institute, Sally Kwenda, a cancer warrior, as well as David Makumi. He is the Vice Chairman of the Non-Communicable Disease Alliance of Kenya and also the outgoing Chairman for the Kenya National Network of Cancer Organization. Thank you so much to all of you this morning for being here, representing your specific groups and getting Kenyans answers. So thank you very much. So you're watching Daybreak. We need to take another quick commercial break and create time or the space for Chef Ali and Willis Raburu. They are about to cook breakfast, a few breakfast tips. I have no idea what they're making. Only time will tell. So let's take a breather. We'll be right back.